Hi there, my name's Tom Searle. I'm one of the junior doctors on the ward today. Can I just start by taking your full name, please?
Angus Perks.
Nice to meet you. Can I call you Angus?
That's fine.
And how old are you, if you have Angus?
26.
You're 26. I've been asked to perform a hip examination today. That will mean looking around your hips, getting you to stand up and walk, and also doing some movements of the hip as well. Is that all right? Thank you very much. I'll be speaking to my colleagues as we go along, if that's okay. Just before we move on to the examination, have you had any problems with your hips at all?
No.
No. Any pain anywhere?
No.
Okay. Any stiffness in the hips?
No.
Okay. And have your hips been sort of restricting your daily activities in any way? Okay, that's good to hear, thank you. Okay, so first of all I'm going to inspect around the bed. I can't see any aids for mobility or any other paraphernalia suggesting any hip pathology. Now Angus, if you wouldn't mind just standing up for me. Angus is adequately exposed for the purposes of the exam. That's great, thank you. So you can just stand up straight by your sides. And on inspecting the hip, I'm looking for any scarring, any muscle wastage, any asymmetry between the hip joints and any other joints, and any other skin or bony abnormalities. So first of all, I'm looking from the side. And then Angus, if you face towards me, and from the front. And then if you face the other way, thank you. From the other side, and then face away from me. That's great. And there are no abnormalities detected. Thank you, Angus. Now, if you wouldn't mind just walking to the end of the bed and back for me, checking for normal heel strike, toe off, arm swing, and stance phase. That's great, and I can see that the extension of the hip is normal as well. Thank you, Angus. So I'm now going to do a special test that checks some of the muscles around the hip. It's called Trendelenburg's test. And what I'd like you to do is just lay your hands on top of mine, on my arms. That's great. And then if you just lift one leg off the ground. That's lovely. And then the other leg. That's great, and you can relax. So I can see that there's no sagging on either side, so it's a normal test, that's fine. And then if you wouldn't mind just lying back down for me, I'm going to lower the head end of the bed if that's okay. Just make sure you're comfortable. Is that all right? Yeah. All right. So first of all, on closer inspection around the hips, just going to lift your t-shirt up a little bit if that's all right. So I can see again that there's no muscle wasting or circulation. I'm first going to palpate around the hip as well. So just tell me if there's any pain whilst I'm doing this. So I'm just feeling around the ACIS, checking patients in no discomfort, and the greater trochanters of both sides. And there's no pain there at all. Okay. So now I have to measure the leg length of your limbs. I'm going to do the true and apparent leg length. So get my measuring tape. For the apparent leg length, I measure from the umbilicus down to the medial malleoli. So it's 91 on one side, and the same on the other side. And then for the true leg length, I measure from the ACIS down to the medial malleolus as well. So from the right down to the right malleolus, that's 84, and the left to the left, and that's also 84. So there's no discrepancy between true or apparent leg length. I'm now going to ask you to do some movements of your legs, if that's okay. So if you bring your left knee all the way up to your chest as far as you can, and then just relax into my hands. So there's normal flexion of the hip, and the same with the right. And relax. And there's normal flexion both sides. Now if you keep your right leg straight, lift it a little bit off the bed and push it away from me, and then towards me as far as you can. That's fine, you can relax. And the same with the left. If you bring it up towards me and away, and relax, thank you. So abduction and adduction of the hip is normal. Now if you just totally relax and let me take the weight of your leg, it's going to check both adduction and abduction, and also external and internal rotation. And there's normal degrees to both sides, and also with the left, adduction and abduction, and external and internal rotation. There's no pain there at all. Okay, that's great, thank you. One more test I need to do involves me just slipping my hand in the small of your back, if that's okay. It's called Thomas's test. So I'll get down to the level of the patient. Just going to place my hand there now. And Angus, if you flex your right knee, bring it up all the way up to your chest as far as you can. Thank you. And I can see that the left leg doesn't raise off the bed, so there's no fixed flexion deformity there. And relax for me. and then the same with the left leg. And I'm checking with my hand that the lumbar lordosis is totally occluded. And again, there's no fixed flexion deformity of the right. You can relax. Thank you, Angus. Are you comfortable there? Just put your t-shirt back down. That concludes the exam, so thank you very much. In order to complete my examination, I'd also like to assess the joint below and above the hip joint, so that would be the knee and the back. I'll just wash my hands before moving to a different clinical area. Thank you very much, Angus.